we met was probably, and I apologize for not meeting. I think I know everybody was super busy, and then the legislature went into regular session and then override session. But a couple of weeks ago, Peter, who and I were talking and about whether to restart our meetings, and at that time, I was receiving some requests from members of the public who were asking whether we would restart our meetings, and I took that as a good sign, because I think that what this committee has offered to the public is credible information and analysis. And during our absence, I think there were members of the public who were hoping that we would continue to provide that information to them. So that was a reason why we thought we would restart our meetings. So I want to thank you for joining us this morning. We have two topics that we wanted to focus on. First is the economic update. The second is a medical update. So can we start first with Carl Bonham?
Morning, Speaker. Thanks, and thank you, Peter, for the invitation to update the committee. Obviously, a tremendous amount has changed since our last meeting, and a lot has changed since the last forecast that UHERO released. Back in May, when we released a forecast, we were really sort of upbeat about the progress that Hawaii was making, that the US was making on vaccinations. The trajectory was still quite good before a real flattening. I can't show you the history for Hawaii because the data is just too hard to get out of the DOH Tableau dashboards, but it followed a similar trajectory, albeit higher. And obviously Hawaii is at just over 60% fully vaccinated today. At the time, we were sort of concerned about the international community not getting vaccinated. Canada has now surpassed the US. And that was a source for, this progress on vaccination, plus the federal stimulus, the expanded unemployment benefits, the direct payments to households. Those were all sources of optimism that sort of led us to be hopeful that we were going to experience a sort of a Goldilocks situation where, right as some of that federal stimulus and support was beginning to wane, the economy would really be picking up steam, momentum, and we'd be putting people back to work before they ran out of unemployment benefits, before all the federal stimulus ran out, before the eviction moratorium ended. And then there was Delta. And, as has been true throughout this experience, the COVID really sort of controls everything. We have an ability to change that with the vaccination now. We haven't quite gotten there. What I'm showing you is 7-day average of cases per million for the US and for Hawaii. And we are, what's unique about this, I'm only showing a short sample from March to August 1. And what's unique about this case is that our exponential growth has matched the US for the first time in this pandemic. In all other waves, we've really lagged in, well, as in a good way, we've lagged the US experience and haven't had the same kind of case counts as the continent. And that's completely changed now. And if you measure things correctly, if you think about the way we were measuring back a year ago, of course, we were comparing cases per unvaccinated population. There was no vaccine. If we do that today, we're at 379 million, 379 per million unvaccinated population, which just shows that we really are in a new situation, and the worst that we've experienced so far during this pandemic. And this really is a problem for the unvaccinated, as I'm sure Jill and Mark and Ray will talk about. And so, unfortunately, even with the strong tourism rebound, we're not really in a position for the sort of that Goldilocks pandemic in the rearview mirror picture. The visitor recovery has surprised everyone. The pent-up demand, the excess savings, the wanderlust, everything that drove the visitor arrivals. The dark blue line is actual arrivals through June, And the dashed line is what our optimistic forecast was in our last forecast report. And the green line is the 2019 numbers. And then if you just add in the new forecast, so this is a nowcast for July, that would put us at roughly 90% of 2019 levels. And by September, roughly on par with 2019 levels. This doesn't take into account any potential travel restrictions, any major changes in behavior because of Delta. This is purely, looking at seats outlook and passenger counts. So it's there's still a lot of uncertainty there. So despite the strong recovery in the visitor industry, the jobs recovery is only about 40% complete. Back in early part of the pandemic, April and May of 2020, we lost 153,000 jobs. We're still down 94,000 jobs. The food service, those are all measured on the left axis for the total. The other sectors are all measured on the right. So if you look at food service, it was down 43,000 jobs. It's still down 18,000 jobs. So the sectors that were hit the hardest, food service, accommodations, transportation. Unfortunately, I don't have monthly data for air transport. It just comes in transportation and warehousing at that level of detail. But those sectors, food service, accommodations, both lost 56% of their jobs at the start of the pandemic. They both added back a large number of jobs and still down over between 10 and 20,000 jobs. Same thing for transportation. It was down 36%, lost 11,000 jobs, but still down 9,000 jobs. So there's a long ways to go on the jobs recovery. So the jobs recovery is underperforming relative to our old baseline forecast. And, right as we're looking at benefits ending, underemployment remains at near record levels. So these are 4-quarter averages. So in the first quarter of data, so this is truly a comparison with this is really post-pandemic, right? We're comparing if you compare the 4 quarters from second quarter of 2020 to first quarter of 2021, that's 122,000 people who are either they've left the labor force because they're discouraged or they don't want to work in the current environment or at the jobs that they're being offered, or they're working part-time. And it's improved a little bit since the fourth quarter of last year, but we're still talking about 18.5% of the labor force underemployed. And we have the PUA and the PEUC benefits expiring in just a little bit more than 1 month. And so, as I said, we're not really in that hoped for situation, and we're about to see the eviction moratorium end when housing insecurity really hasn't changed much for those in the middle or the lower income. We're talking about the number of adults who are living in households that are behind on rent or don't expect to make their rent being relatively stable at around 26, 27% for sort of income less than 75,000, income less than 35,000, closer to 38%. If you do this in terms of the number of households, it's about 25,000 households and about 100,000 people are late on their rent still. And this is all from the Census Household Pulse Survey. So the last data point was July 5th. We're going to get some new data from them shortly. And unfortunately, the labor market situation, while we do anticipate that the July data point, this is a nowcast of July jobs, it shows about a 10,000 person increase in jobs in July, and it's purely based on the economic pulse, which has flattened out some, hasn't turned down. Right now, there's no sign in the high frequency data that we're tracking of a market slowdown of any kind associated with Delta. There has been a jump in people searching for COVID on Google, but mobility data has not retraced. It has not gone down. People are not going to restaurants less, at least according to open table data. There's been no sudden drop off in activity. And so as of now, we don't have a prediction that Delta is going to cause a market slowdown in the economy. What I'm showing is our second quarter baseline forecast, second quarter low, and then the dash line is just what you get if you update that forecast using more recent data, but without taking into account any kind of effect from Delta. So it really just reflects the fact that jobs, well, one, that we have revised GDP data, but two, that job growth is a little bit slower than what we had in our baseline. So for now, I mean, we're beginning to work on our next forecast release, and we'll get that out as soon as possible. But at the moment, there's no clear sign, that people are retrenching because we know how to deal with this, right? We know that the way to deal with this is to get vaccinated, to wear masks, and to socially distance, and we can do that while still maintaining a high level of economic activity. And that's all I have, Speaker. Mahalo.
Okay, thanks, Carl. So we'll take questions. Any questions or comments from anyone? Any questions?
Speaker, I have a question for Carl. It's Peter.
Okay,
Carl,
Peter.
good morning. I'm wondering, the jobs recovery or lack thereof here in our marketplace, how does that compare to the national experience?
We're lagging behind in terms of job count. So we still have a very elevated unemployment rate compared to the national average. But throughout the entire country, everybody is experiencing a level of difficulty in hiring, right? It's not unique to Hawaii. And it is predominantly in the service areas, in accommodations, in food services, a little bit less in retail. So our picture is similar, but we'd like to see more progress. We think we will. We think that July and August are going to be better, and I guess that's really sort of one area where Delta could have an effect. Is it could impact people's willingness to go back into the workforce.
Great, thank you.
Are there other questions or comments?
Speaker, this is Raponishi.
Yes, Raponishi.
Hi, Carl. Thank you for providing us that information. I had a question in regards to especially the hotel industry, where we're hearing that there are former hotel employees that are not being rehired, or hotels are not rehiring. Yet our visitor counts are up, and many hotels are having successful, I guess, what do you call, reservations and visitors' arrivals. Is that the industry just cutting back on jobs, or is it people from other sectors migrating to the hotel industry? What's your take as to what's going on?
So I don't have an exact answer. I have some theories. There's good reason to think people from other industries would be trying to get hotel jobs. Hotel jobs are relatively high paying in the service space, and so they're desirable. One thing we need to keep in mind that we should never have expected that sort of once the switch is flipped on number of visitors arriving, that you would instantaneously bring back all of the former hotel workers or any industry, right? This is something that takes time, and you have to remember that these businesses lost an enormous amount of money during the pandemic. And one of the ways that they try to recover is to try and generate revenues without generating costs in the short run. And so there will be a tendency to make sure that they're fully operational to the extent possible with the existing staffing levels before they start bringing people on. I would suggest that the hoteliers are having just as hard a time as everybody else finding workers. And so, I can't speak to whether, they're choosing not to bring back former hotel workers. I don't have that information. I'm a little skeptical of that. Given the shortage of workers that we're seeing across industries, it's pretty hard to imagine that, as we get into July and August, and we're talking 90%, levels of visitors, that you wouldn't see the hoteliers bringing back their former workers. One other thing to keep in mind is that these numbers are going to differ a lot across counties. So, while Maui is beyond full, Oahu is not. Has not experienced the same type of growth because the visitors who are coming are U.S. visitors, right? They're not the typical international visitor, and so it's going to differ tremendously across counties.
I have a follow-up question. When we talk about the jobs and where we're at in terms of job loss and current jobs, is that count jobs available or actually people working?
Yeah, so those are literally filled positions, right? So that's just your normal Bureau of Labor Statistics data on job counts. So it doesn't represent job openings.
Is there a way for us to get that data as like how many jobs are available? Because, one of the things the state did was require 3 searches a week in order for you to maintain your unemployment benefit. But we also lack the staff to fully investigate, right, the information that's provided by the claimant. Once the Plus Up terminates in September, there is, I guess, some expectation that people will now seriously start looking for jobs because they're going to be losing about $1,200 a month, in income. So any projection on that?
So yes, we, obviously as benefits wane, I mean, the benefits are having some impact on people's willingness to work. There's no doubt about that. It's not the only factor. The evidence nationally, there's actually some pretty decent evidence nationally that if you compare the states that canceled these federal Plus Up benefits, many of them in June, early June, if you compare them, there's about 25 states that have already gotten rid of those benefits. And if you think of some of these benefits mean people lose all benefits, right? So some of these are emergency benefits that once that federal program's gone, these workers have nothing. And if you compare those states that eliminated those with states who didn't, there's virtually no difference in their employment to population ratios. So in other words, we're not seeing a surge in people finding jobs, and that's discouraging because it would have been encouraging if we could count on more people getting back to work in July and August. I still think we're going to see that because of the strengthening, the demand for workers will continue to grow, and you'll see wages continue to grow and encouraging people to go back to work. There is data on job openings, quits. There's new experimental data. Actually, I don't think it's experimental anymore. It's called the JOLT survey that Census publishes. We have been a little reluctant to use it just because the sample size for Hawaii is just incredibly small. So it's really an estimate. So, but there is data available. So it's taking essentially West Coast data, it's taking a small survey from Hawaii, and it's using that to estimate what the job openings, job finding, and quits are, I believe, on a monthly basis now. And I'll be happy to share that information with you offline.
Thank you. Thank you, Speaker.
Okay, thank you. Are there other questions or comments, Rep. Balani?
Thanks, Speaker.
Go ahead.
For Carl and possibly for Lisa, since we might be resuming these meetings, Carl, is UHERO tracking the impacts of the child tax care credit that is coming into the state to families? And is that having any kind of positive impact on the early learning network we're having sector that in Hawaii?
That's a great question. So we were aware of it. We were thinking about it in terms of our forecast, not so much in terms of, and clearly those resources are going to make an enormous difference to families in Hawaii. How it affects early learning, we have not been tracking that.
Thank you. Just for some future thinking. Thanks.
Thank you.
Okay, thanks. Are there other questions or comments?
Speaker, this is Pamela. If I could make a comment.
Sure, Pam.
Good morning and aloha, everybody. For Rep. Onishi, I just wanted to comment because, as Carl mentioned, each of the islands is very different. On Maui, our Maui Hotel and Lodging Association did a survey recently, given the moratoriums proposed by our county council to prevent expansion of the visitor industry. And they had, on June 23rd, 558 job openings that they were desperately trying to hire back as quickly as possible. We're hearing hotel GMs having to even help restaurants bus tables and help clean pools at times. So they're actively looking. And then we surveyed our chamber members, and in a week and a half, we found over 150 vacant positions outside of the visitor industry. So on Maui, what we're seeing is the need to bring people back. And in the hotel sector, there was a report late last week where if we can't get more workers back, they were having to look elsewhere to find workers. So it's a challenge when we know that unemployment's about to end, but yet September is still a very long way for them to wait, given the visitor industry response we've seen. So I just wanted to share that with you.
Pam, I had a comment. Have you guys also did a survey of wages? I know they're having a hard time with hiring, but have they looked at adjustment in wages for those jobs?
I don't know that they've done a survey, but I definitely know that the demand in the market is causing both in the accommodation sector as well as the business sector across the board. We're seeing people paying higher wages to attract. We're seeing people paying considerably higher wages to attract workers. And also we're seeing a wide variety of things offered, like increased benefits, bonuses, signing bonuses, and things of that nature.
So Rep. Onishi, the wage data is available from Bureau of Labor Statistics and DLIR for people who are already working. And the data through June, unfortunately, doesn't support that we are seeing increases in wages. Of course, it also is affected by the mix of workers. So it's not, you know, there may be, I have no doubt that some businesses are increasing incentives, but in the official data, the statistics that we have available, it's just not showing up.
Okay, are there more questions or comments? If not,
Mufi, may I chime in a little bit? Hi.
Mufi.
So relative to Representative Onishi's questions, I agree with what Pam has said. I think what's happening on Maui is also indicative with our hospitality industry in general. When they can, when the demand is showing it, they are trying to do their best to bring people back to work, offering incentives and the like. In fact, we're joining in with a job fair. We've never really done that, but we're making a very special hospitality push at the Star Advertiser Job Fair coming up on August 4th, just because of the fact that we found that individual efforts by a lot of the resorts and related businesses are not resulting in much success for a variety of reasons why people are not coming back to work. So hopefully with all of them gathered on the one tent, if you will, we're going to see much more success in that area. With respect to housekeeping, most hotels that we're aware of are all doing an opt-in, opt-out. CDC guidelines have not changed since November that says guest rooms occupied by the same customer over multiple days should not be cleaned daily unless requested. And we know there are those out there that feel that the room should be cleaned daily, which is why If we did that, then there'd be more housekeepers to hire. But we also know that some employees have also requested of management that they don't want to do daily cleaning just because of that interface interaction, or lessen it if they didn't have to do that, and just wait till the guests to say, you know, I will require that, or all I want is linen today, and the like. So it's very challenging all the way around. But, you know, if we're aware of anyone who's deliberately doing what some have accused us of doing, that obviously will be frowned upon in the industry. And I've encouraged all those that have said that, you know, to let me know what hotels may be doing that. But so far, I think everybody's trying to do the best they can, and also keeping into mind the fact that we want a safe workplace environment, and employees who do not want to clean their rooms daily kind of follow the policy that these hotels have of an opt-in, opt-out. If you want to do it daily, some are doing it daily, others are just leaving it up to the guests.
So, Rep. Onishi, I just looked up the data on the JOLTS survey for Hawaii, and what it shows is that as of, unfortunately, it's only through March, so it's not as current as I expected. 27,000 jobs opening in March, 21,000 hires, 13,000 quits, and 9,000 layoffs and discharges, or a total of 24,000 separations. So we actually had more job separations than hires in March of last year, excuse me, March of this year.
Any other questions or comments? Carl, I just have a fast question. What was the, is there an analysis of what the population loss was up until now?
You asked a fast question that has a long-winded answer.
You give a short answer.
In 2020, the intercensal estimates showed a decline in population of 0.6%. That's a faster decline than we've seen, but now it's complicated by the fact that we now have a census, a new 2020 census, which you know, you can't see what happened between 2018, 19, and 20 with that data. So I would stick with an assumption that population declined. We certainly know labor force declined, and some of that is people leaving.
Okay, thank you for the short answer. So we can move on to the second topic. This is our medical update with Joe Haggard Green, Mark Mugishi, and Ray Vera. I'm not sure who wants to go first.
Speaker, I'd enjoy going first if that works for you.
Okay, that's great.
Why don't you jump in, then I'll follow and we'll go from there.
Excellent. So, and then Mark will follow. Carol, as always, did a beautiful job of starting this conversation about showing what was happening with vaccination and the increased number of cases that are happening in our community. So unfortunately, I'm going to talk about a challenging issue related to the Delta variant that is in our community. Now, we know a lot about Delta because that variant has been in other countries, England, Scotland, Canada, and Israel. And now it is going across our country, and it is in Hawaii. This is a variant of concern. So if you remember our discussions about COVID, we know that viruses mutate over time. And this variant has some very uncomfortable properties about it, which will require us to be very rapid and focused. The first is that it spreads extraordinarily rapidly. If you were recalling our conversations last year, when we talked about COVID and its spread, we'd say one person usually spreads it to 2 to 3 people. With the Delta variant, one person can be spreading it to 7 to 9 people, significantly larger numbers. You'll hear people, and you'll see it in the news, where they'll talk about the spread looks like chickenpox, because chickenpox moves much faster than what we have today. So its spread is faster, and so the ability to infect more people is there. That means if we're gathering in large groups, one person could impact a lot of people very rapidly. And you'll see in the news cases where they'll talk about clusters that look bigger than what they've been in the past. And it's because the spread is faster. The second thing is, if you are not vaccinated, the severity of the illness may be greater. So it's critical. And the reason that occurs is we know that the Delta variants can have what's called a higher viral load. It's producing more virus. So your body, if you're vaccinating, you are fighting, and you are fighting hard. But if you are unvaccinated, you are not prepared to fight that virus. So the rates of hospitalization with unvaccinated people may actually go up. Now, the good news is we know several things that can fight this. The first and most important thing is vaccination. So our focus as a community has to be getting everyone that can be vaccinated. And Ray will share what's happening with our respective organizations, and you'll see it across the country, because we have to get vaccinated as quickly as possible, particularly for our keiki, because spreading this to the unvaccinated, right now our largest groups could be our keiki who don't have or are not eligible to get the vaccine at present. So you'll hear me saying, please get your vaccination, not if for you, for the people that you love, and particularly for our keiki. The second is all of us, whether we're vaccinated or not, need to mask up. We're back to our masking policies, and that's because, and practices, and everyone should be doing that, indoors, outdoors. It's because that spread is so rapid. If you're vaccinated and you have your mask, you are ready to fight this disease. And third, keeping social distance. So we do know how to fight this. What we're already seeing in our hospitals in the last 2 weeks, about 2 weeks ago, I would say we had about 4 patients in Queens hospitals that had COVID. This morning, it was 56. Every day, it's rapidly going up, and it's rapidly going up predominantly with individuals that are unvaccinated. And as a health system across all of our health systems, we're prepared to care. There's no question. But we've got to mobilize getting those vaccinations. So I'd like to turn it over to Ray, who's been a very strong leader and partner in vaccinations in all of our communities, and will share what we're doing as health systems.
Thanks so much, Jill. And, first of all, I want to reiterate everything that Jill said is spot on, about the Delta variant and about the risk of spread throughout our community. And most importantly, the importance of getting vaccinated. Really, this is completely within our control as a community to limit the spread on a broader basis if we encourage everybody we know to go out and get vaccinated. Further, of course, as Jill said, wear masks. I think we need to double down on wear masks right now. I think it's an easy way for us to add layers of protection, whether you are vaccinated or not. I think it's extremely helpful. And again, social distancing, managing the size of gatherings. And what we still see people being a little lax on is if you're feeling sick, stay home and avoid others and don't gather as much as I know we all want to, because that's where we run into challenges, is when you're not feeling well and you're just even mildly symptomatic and you go out and integrate with the community. That can be problematic. So again, first, get vaccinated, wear a mask, socially distance, stay home if you're sick, avoid large gatherings, and if you do all of those things. And I think also, as business leaders and employers, we need to really be thinking about how we address these within our workforces. And what I'd encourage you to do is, we've got what we think is some exciting news coming out at 11 o'clock from the healthcare organizations about expectations that we're going to have for our workforce. And so I'd encourage you to watch that. The Healthcare Association is going to be doing a press conference shortly. And I don't want to steal that thunder, but I will tell you that I'm very proud of our industry and Jill and her team and my other colleagues throughout the healthcare industry who have come together to make a clear statement about the importance of vaccines. So again, get vaccinated, wear a mask, and socially distance, and stay home if you're sick. All right, I'll turn it over to Dr. Mogishi to sort of make some sense of what we all said.
Yeah, thanks, Jill and Ray. I actually don't have very much content to share, but maybe I'll put it in a metaphor that helps people understand. And first, I'll just say that, over the weekend, the Washington Post leaked some internal CDC document that Carl was kind enough to actually share the leaked document to a bunch of us. And I had a chance to look at it, and it shows a couple of things. It shows the Delta variant is bad news, but it shows that the vaccine is really, really, really good. And so that just underscores what Jill and Ray have been saying, is that getting vaccinated is our #1 priority. It's not perfect. That's why you've heard about breakthrough infection. So the story I'm going to tell, if it's raining, you tell people wear a raincoat when you go outside. And if it's not raining too hard, the raincoat's going to do well. And it's going to keep you pretty dry. But if it starts to really pour, then maybe even if you're wearing a raincoat, that's the vaccine, by the way, you might get wet. So common sense says take an umbrella too, because then that'll shelter you, right? So, and that's our masking now. Even if you're vaccinated, even if you're wearing a raincoat, the Delta variant's a pretty hard rain, so put on that umbrella as well. Now, if it's just torrential, obviously both a raincoat and an umbrella might not help. So somebody might have to issue a mandate saying stay home. We're not there, because honestly speaking, if you're trying to get people to wear a raincoat, you don't get them to do that if you tell them they have to stay home. No one's going to buy a raincoat when they're staying home. So if our #1 priority is to get people into raincoats, I think that's where our focus needs to be, and that's what we should be doing. So that's my little metaphor about how I think we should be handling this. And essentially, it's exactly in agreement with what Ray and Jill have been saying.
Okay, thanks. Are there any questions or comments? Any questions? We're fortunate because we have the best medical team on our committee.
I'd like to maybe ask a question, see if it's true. We had several doctors on our Business Matters radio program on Maui. And one of the things they said that really surprised me was that for those who are unvaccinated and seeing the unvaccinated numbers rising in the hospitals, one of the first things they do to help alleviate symptoms is give them the vaccine. And I was surprised that if that's accurate, why we're not hearing more about that. So for those who are afraid of getting the vaccine, if they understand, hey, if you catch this, one of the first things they're going to give you in the hospital is the vaccine. I just wondered if our team could comment on that.
So I'm happy to make a comment about that, and I'm sure Ray will as well. Right now at Queens, we don't give the vaccination on admission because most of our patients are very, very critically ill. So we are taking care of them first and stabilizing them. But we are, if you come into the emergency room for other kinds of issues, we ask, would you like your vaccine? And we're giving it as you finish your emergency room visit. If you're coming in, if you've been with us for a period of time, we're giving the vaccine, but it's always based on the person's actual ability to take the vaccine at that time. So your clinicians are making decisions based on the unique need of the individual, but we are giving vaccines in the hospital, particularly before the person's discharged, if they request it, and if the physician says it's the appropriate thing.
Yeah, I haven't necessarily, I'll take a little bit of a different bet. I agree with everything Jill said, but I haven't heard it as a therapeutic in terms of responding to an active COVID case. But the science is changing consistently, but I haven't heard it of being used in that term. But again, if someone comes into the hospital for almost anything, and if they haven't been vaccinated, we're offering it up to get them vaccinated. I mean, you just have you just sort of have to walk by us slowly, and we'll put a needle in your arm. Get you vaccinated.
Well, I appreciate you commenting on that because no, it was mentioned as something that was once somebody was hospitalized, it was a therapeutic thing to sort of help alleviate symptoms.
Well, I'd appreciate Dr. Mogishi commenting on this because again, I easily get out over my skis. I'm not a doctor, but I have lots of opinions.
Yeah, I actually, I haven't read anything that says that it helps with the, therapeutically, but it's like a tetanus shot, right? So when somebody steps on a rusty nail, the first thing they do when they come in to seek medical attention is they get a tetanus shot, not because it's going to help them with that episode, but you have a captive audience and you want to immunize them against it for the next episode. And I think that's primarily what's happening with COVID, is that as soon as we have somebody who's there, we're going to try and make sure that they remain immune.
Thank you.
Do we have hands raised from Wendy Laurels and then Lauren Zerbo?
Thank you.
Wendy.
Just any news on when any of the vaccines will actually have full approval? We know that that's one of the arguments for some of the folks that are hesitant.
Hi, Wendy. The latest thing I've read is that the FDA is targeting early 2022. But even the CDC, another federal agency, was just shaking their head is a strong way to say it, but they were saying that there's been almost no FDA approval that has hundreds of millions of data points to base their approval on. And so nobody can quite understand what's the holdup. I mean, there's actually more clinical data for this than almost anything that's ever happened. So it's kind of hard to imagine why it's going to take till then, but that's what they're targeting.
Okay, Lauren.
Thank you, Speaker. I have a question. Is there a slide that shows the hospitalization numbers from today versus like 2019? Because I know in Israel, they had showed that even though a lot of the vaccinated are getting COVID, their hospital numbers are still really down from 2019.
We know right now the total number of hospitalizations by day because we all submit those every morning. This morning, there were 150 people in hospitals that are reporting, and that's basically all of the hospitals as of this moment. And we get a daily update, we can get you a trend line and compare it to last year at this time as well. We know for Queens, I asked them for our teams, and Ray has the same thing. We have analytics teams that are constantly updating our data, both on the state basis as well as internally. They were looking at our RT rate of transmission rates. They were comparing our slopes of the curve to where we were last year. And unfortunately, the slope of the curve looks exactly the same. It's in that early spike phase that's going straight up for us. That's why you see, very small numbers of patients 2 weeks ago and now in the mid 50s. So we anticipate it still going up, and we're watching the case counts every day. One of the things we don't know that's really important is because there's more vaccinated people, even with the Delta variants, there should be a reduction in the number of people getting hospitalized. So we used to use a barometer of 10% of whatever you saw that daily number is going to be someone coming into our hospitals in the next 5 to 7 days. Right now, I can't tell you what the percentage is because it's too early in the curve, but I'm hoping that percentage is lower because we have so many vaccinated people.
Yeah, the other part to your question you asked about compared to 2019, I don't have the data sitting in front of me, but I can tell you anecdotally that we're busier in our hospitals today than we were in July and August of 2019. And the reason I can tell you that is because July and August are generally our slower months because of travel, and we will have been outside of the flu season and things of the like. And so July and August are generally some of the slower months in terms of inpatient hospitalizations. And from what I know of the Israel study, as it relates to COVID cases versus hospitalizations, that makes sense. The Israel study, while certainly has some value, it was a little bit of a different kind of a study because they used surveillance testing, which they took a population and they did nasal swabs and they tested to see if, in fact, there was COVID present, which of course, when you have something like the Delta variant around, you're going to have COVID present if you do a nasal swab across a broad spectrum of the population. But what it doesn't mean is whether or not you became symptomatic and got sick with COVID, because the fact is probably many of us would, if we did a nasal swab, would have some presence of COVID because it's out there and about in the community. The question is whether the vaccine did its part from stopping it from going into our body and developing symptoms and causing it to worsen. And so, in fact, you would expect to find more just on a general nasal swab, but that doesn't mean that you got sick from COVID. And that's what why some of the alternative studies have different findings as it relates to the Delta variant.
Yeah, and I think the other kind of relevant point with regard to hospitalization, which is really the true metric that we should pay attention to, because obviously the key thing to starting to reach for different tools in our toolkit will be whether or not the hospital systems become taxed. And, because we can do a lot of things prior to that. But in that CDC data, which was all across the entire US up till the last week of July, 4% of hospitalizations were vaccinated and 96% were unvaccinated. So again, really important to understand that the surge in hospitalizations was predominantly a phenomenon of the unvaccinated. So sounding like a broken record, but that's why the focus should be on getting people vaccinated.
Rep. Bellotti has a question. Rep. Bellotti.
Thank you. Two questions. First, and sort of touched upon it already, what are the data thresholds when the hospitals might start to pull back on elective surgeries or procedures? And then second question is, are data systems ready and able to quickly report what's happening in our younger populations as our schools get ready to go back? And in particular, I'm really thinking about that 6 to 11-year-olds who cannot get vaccinated and who will be going back to school, which I support entirely. But are our data systems able to tell us quickly what's happening there?
So your first question related to, do we have the ability to see where we're at as hospitals and what our percentages are? The answer is yes, and for two reasons. One is, from the beginning of the pandemic, we've all been participating and continue to through the Hospital Association. They can see every day where we are, number of COVID cases, total census, number of people on ICU. So we have trend lines throughout this entire pandemic. Just as an example, Queens has been operating at around a 98% census, actually through the whole summer. Now, when you ask the question, when do you start pulling back on elective procedures or surgeries? We've been titrating to the need. So what that means is right now we'd be saying we're going to level the number of cases because we've got to make sure that that ICU bed is open for the next patients that come in with COVID. So in fact, every day we're doing a titration of how much can we have today, because just as Ray said, our community is open. The number of very sick people that are in our hospitals, trauma patients, stroke patients, we have to take care of them. So our volumes are up because of that. And then we are managing day to day based on making sure that we can provide the right care to the right patient. So far, we've been able to what I'll call titrate that, which may mean your procedure is moved for a day or two or into next week while we're assuring that we have the right capacity to assure that everyone coming in through the emergency room is getting the care they needed. So we don't do blanket statements to say we've just stopped everything. We work with our physicians, and we are providing absolutely all urgent care and emergent care and care that clinician believes needs to happen today. It's happening today.
I would also add that we are working very hard and closely across the industry as a system of care. And so that we use one another's beds and we make sure that the capacity is there, because the fact is we've done a great job as a community in terms of getting a lot of people vaccinated. And the community is open. And so we need to be able to keep those services open and care for the community, both on an emergent and an elective basis. That's representative of a community that is open and beginning to reestablish itself in the post-pandemic era. But I do think you raise another broader issue that defines why this current surge looks and feels so different than the surge even a year ago. And it's because, one, we've done a good job and we got a large portion of the population vaccinated. So we're dealing with a much smaller denominator, if you will, in terms of the at-risk population. But also, I think we would all agree that we have a different set of tools in our toolkit. On the positive side, we've got different therapeutics. We take care of the patients differently. We know it's a younger population. They have less severe symptoms, but we also know that we don't have the same tools in terms of reaction and response as a community. The likelihood of us going back to a complete lockdown, given the size of the denominator at this point, is very low, if not possible at all. We're having active discussions, which I suspect we're going to hear about today, about returning our Keiki to school on an in-person basis. And so on one hand, we're dealing with a smaller population, of course. It's the unvaccinated, which we need to continue to push to get vaccinated. But on the other hand, the response portfolio of options is very different as well. And so it takes day-to-day active management to make that happen, I think, on all fronts.
Are there other questions or comments? Any questions? Rep. Onishi?
Yeah, I had a question in regards to the Hawaii Safe Travels program. And if you folks have seen any data in relationship to visitors coming to Hawaii, either being infected or getting infected in Hawaii, and has that affected our healthcare system at all?
I have not seen any of the most recent data on the infection rate among travelers. But I can tell you, just from our population of patients and what I gather from listening to my colleagues, the far majority of the people that we're seeing hospitalized, at least, are not tourists. They're residents who are actively engaging in activities throughout the community and family gatherings and gatherings as such. So I frankly don't think that the current surge is related to travel in any significant way. That's just the way I interpret the data.
So our data at Queens would indicate that, and these are the recents because we're looking at the last 2 weeks, there isn't anyone that we would say was created from a traveler in terms of spread it. What we have seen is a significant amount of community transmission, and we've seen transmission from residents who traveled and then traveled back. So travel going to a community that had a high rate and then coming back did make a difference. Most of those individuals were getting testing and immediately quarantined. So we haven't seen folks from the continent come over and spread it. We're seeing folks from here go to other places and then coming back, and it occurring 3 to 7 days after they get back here.
Carl, you have your hand up?
So, Richard, that data is available on the DOH website, and it shows exactly what the doctors have been talking about, is that the lighter blue bars are residents who have traveled, and the dark blue bars are visitors, non-residents, and the numbers of non-residents, the highest was 11, and they tend to be more like 3 or 4, and the non-residents are, the residents are in the 30s and 40s.
Somebody else had their hand up. I missed it. Does somebody else have their hand up?
Hi, it's me. I do, Wendy Laros, Kona Kohala Chamber. Okay. Yeah, just a quick question about helping employers with any recommendations about helping them figure out how to encourage vaccinations for their employees. It's a tricky situation, and if anything that you might want to add about, what are those rules and laws and human resources kinds of guidelines that we all have to deal with? How are you handling it, and what would you say to employers to help them get their employees vaccinated?
Well, do you want to start with that?
Yeah, I think, I know every industry is different. I'm a believer in mandating workforce vaccinations. There are some things that have to be considered around, and policies that have to be created around exemptions and testing. And I know myself or Jill or others would be more than willing to share, our work product of what we've seen around that. Now, we understand everybody can't do that for a number of reasons, but I think there's the do nothing strategy, and then there's up to a mandate and everything in between. And you have to figure out which best works for your environment.
Yeah, and I think a couple of the in-betweens that are most prevalent are the in-between where the person has a choice between vaccination or weekly testing. That's one kind of leaning toward the mandatory vaccine side because it's hard to tolerate weekly testing. The other is the scarlet letter version, which is where you identify with a some type of sticker on your badge or anything like that, the vaccinated population, and they have certain privileges that are allowed in the workplace. Like you can come into the workplace, you can take business travel, you can X, Y, or Z, whatever the business wants to say is a privilege of being vaccinated that you cannot get if you're not. So that's another kind of common thing that employers are looking at.
Well, thank you, Mark. We can always count on you to provide the newsworthy soundbite. You just saw it here first.
Thank you.
Okay, are there questions or comments? Any questions?
I had a question, maybe more for you.
Lauren.
How far off do you think we are politically from mandating vaccines for certain activities or, even for state workers?
I think we have to ask the governor that question.
Okay.
I have no idea where the governor is at, unfortunately. Okay, any other questions? Political or otherwise? Okay, if not, thanks everybody for joining us this morning. I think that we will probably have to have some follow-up meetings, so we will email you with some dates and times. Peter, do you want to say anything to close? Or Carl well, first.
When you threw out the offer of any kind of question, political or otherwise, it occurred to me, I wonder what we're doing in our individual workplaces, and I'm most worried about state workplaces when there's, so if you had let's ask the doctors, if you had a case, a positive case in your office, someone working in your office tested positive, was in the hospital, what would be the right procedure? Close contacts presumably would go home and quarantine and get tested. And you would probably offer testing to everyone and vaccinations and so on. And my guess is that, and this comes from reports I'm hearing from different people, that this is not what's happening across state government, that we don't have a single policy that everyone is following. It's sort of whoever's in charge of that particular office follows whatever rules, and they're adjusting as they go. And it may be in response to the fact that we had a high vaccination rate. We thought this was in the rearview mirror.
So I don't have any information about the state, but just to share, you asked what we do. We're very rigorous. If anyone has contracted the disease, tested positive, if anyone has a family member who has the disease, we do what's called surveillance testing. We immediately get all the close contacts, and we go broader than just the immediate close contacts. If you don't do that, you're likely to have spread and not know it for a week or two, and then it spread more. So it is very safe when you do it. Our team members actually, at first they were a little worried about it, but now it's just a given. If they get the call, they're getting testing. And I know we have so much testing available everywhere, and we would work with you in any ways you need it. Ray's team, my team, to make sure you have testing. Its time is of the essence when you have a person that's tested positive. Mark, you've been doing advising lots of businesses.
No, I think that's correct. And for at minimum, right, if there's a positive case, all close contacts by the CDC recommendation should get tested at 3 to 5 days. The Delta variant tends to transmit a little bit faster than the original variant, so 3 to 5 days is a good window, as opposed to before we used to say 5 to 7 days or something like that. So for sure that. And what you're doing in a healthcare setting is absolutely appropriate.
Rep. Ichiyama, do you want to add anything on government policies that you're aware of?
Well, I think everybody has heard at the federal level what President Biden has ordered for federal employees, either vaccination or mandatory testing. So I think that states across the country are looking at this issue and trying to navigate, I think like Wendy mentioned, a very complicated human resources and policy questions that have to be answered. Thank you, Speaker.
So I'll just jump in here because I really believe that government has to be a leader, has to take the lead on these difficult issues. So I'm going to be working in the House to establish a vaccination policy for House members and staff. Basically the requirement would be a vaccination, but in the alternative, if someone chooses not to be vaccinated, then they will need to take a weekly test. So that's a policy that we'll be working on for the House.
Speaker, I wonder if it isn't, given how much things have changed in the last 3 weeks, how we've really turned everything on its head, it just strikes me as it would be a really good idea if we could ask the governor to reiterate policies to his cabinet, to the heads of departments, so that everybody is sort of on the same page on how we keep this from spreading.
Yeah, we absolutely will do that because the governor needs to be decisive and he needs to be clear on what our policies are. So I agree with that. We'll follow up. Okay, are there any questions or comments? Peter, do you want to add anything?
No, first of all, great session. Thank you. So Carl, just to answer your question, and at the bank, we have pretty stringent policies in place. And the first thing we always do whenever we have a positive in our workplace is contact our healthcare consultants at Hawaii Pacific. And the second thing we do is follow through on a pretty rigid process to get people that have been in contact tested. I think it's pretty clear that the Delta variant is a totally different game than what we have unfortunately all lived through for the past year and a half. And I was frankly stunned at the statistics that Jill shared. I guess I understood the chickenpox analogy, but I just didn't really know what that means. But jumping from one infecting 2 to 3 versus one infecting 7 to 9, I think clearly demonstrates that this is a completely different ballgame that we're in right now. And, different from a year ago, we know what the answer is, it's vaccination. And so I agree with all of those that chimed in around just the need to vaccinate as many folks as possible within our community to get beyond this, because there's a lot at stake here. So thank you, Speaker.
Okay. Thanks. So thanks everybody for joining us today. We will email you with the next meeting date. So thank you very much.
Hello, my name is Anna, and I'm an intern at the Bishop Museum. So what I'll be discussing is about rat lungworm, to be exact. Let's just dive right in, which is rat lungworm. It's a type of parasite that affects all types of hosts, such as rats, snails, humans, fish, and that's what it looks like. And for humans, there are many symptoms if we have it, such as headaches,